Atypical wounds, they're not what you think. After being a wound care physician for over 10 years, I've seen it all. Most wounds fall into familiar categories: pressure ulcers, venous ulcers, arterial ulcers, diabetic foot ulcers. But every once in a while, you'll see a wound that doesn't fit the box. And those can be some of the hardest and scariest wounds to treat. By the end of this video, you're going to know what atypical wounds are, how to recognize when something doesn't add up, and what steps you can take to fix the problems fast and without guesswork. A lot of people think every wound can be explained by pressure, blood flow, or diabetes. And yes, those cover most cases. But the truth is, not all wounds follow those rules. Some wounds are driven by autoimmune disease, cancer, or rare inflammatory conditions. If you don't know that, you can spend weeks or months treating the wrong problem. So let's start with the basics. An atypical wound is simply a wound that doesn't fit the usual categories. It might start suddenly, it might spread rapidly, it might look more painful or more destructive than you'd expect, or it might look deceptively small on the surface, but hide something deeper. Let me give you an example: pyoderma gangrenosum. This is an inflammatory condition where the body's immune system actually attacks the skin. It can start as a small red bump, then ulcerate, and before long, it's a painful crater with purple undermined edges. If you mistake it for an infection and try aggressive debridement, you can actually make it worse. The treatment isn't just wound care, it's immunosuppression, steroids, biologics. I'll never forget a patient who came in with what looked like an infected ulcer on her lower leg. We cleaned it, dressed it, and even started antibiotics. Nothing helped. It just kept expanding. Finally, dermatology saw her and diagnosed her with pyoderma gangrenosum. Once she started systemic treatment, the wound began to calm down. That case taught me not every wound that looks infected actually is. Now let's talk about cancer-related wounds. These can happen when tumors invade the skin or when skin cancer itself breaks down tissue. They often bleed easily, smell, or create fungating growths. They're not only physically difficult, they're emotionally devastating. For patients, the wound becomes a visible reminder of their disease. I once had a gentleman with a wound on his chest that looked like a non-healing ulcer. At first glance, you might have thought it was a trauma wound, but when the biopsy came back, it was actually a skin cancer. The wound wasn't going to heal in the traditional sense. It needed oncology management. That shifted our role from close this wound to support, comfort, and dignity. Then there are vasculitic ulcers. These are caused by inflammation in the blood vessels. They can look punched out, painful, and often appear on the lower legs. Unlike venous ulcers, they're not helped by compression. And unlike arterial ulcers, the blood flow might be normal. The problem is immune-mediated. This is why knowing the context matters. If a wound doesn't match the person's risk factors, or if it isn't responding the way it should, that's your clue. So how do you actually spot atypical wounds in practice? Here are some red flags I look for. The wound appeared suddenly without trauma or pressure. It's spreading faster than expected. The pain seems out of proportion to the size. It's not responding to appropriate treatment after several weeks. The edges or the base look unusual: purple, rolled, raised, or with tissue that doesn't behave like granulation. If you see these, pause. Don't just double down on the same dressing. Think, could this be something atypical? Now let's talk management, because even though atypical wounds are rare, they're not hopeless. First, don't delay biopsy. If you suspect cancer, vasculitis, or pyoderma, get tissue. It's better to have a clear diagnosis than to keep guessing. Second, call for help. These wounds often require a team. Dermatology, oncology, rheumatology, wound care providers play a key role, but we don't have to do it alone. Third, focus on the person, not just the wound. Atypical wounds can be disfiguring, painful, and isolating. Dignity, comfort, odor control, those matter just as much as closure. And honestly, that's one of the big reasons I started the wound care circle. because wounds like this can feel overwhelming, even for experienced providers. Inside the community, we share real cases, compare notes, and talk through exactly these kind of challenges. It's a space where you don't have to figure it out all on your own. You can learn from others who are facing the same tough situations. The link is below. I cared for a woman in her 50s with a leg ulcer that looked unlike anything I'd seen before. It was large, irregular, and extremely painful. We tried compression, offloading, advanced dressings. Nothing worked. I started to feel like we were failing her. But then a biopsy revealed it was vasculitis tied to her autoimmune disease. Once rheumatology got involved and adjusted her medications, the wound began to stabilize. That experience reminded me, sometimes the bravest thing we can do is admit, this doesn't look typical, and then ask for help. So here's how I think about atypical wounds now. They're puzzles. They test your humility, and they remind us that wound care isn't just about products. It's about pattern recognition, curiosity, and collaboration. If you're new to wound care, just remember this. Most wounds you see will be the common types, but keep a mental box labeled atypical. If a wound isn't acting like what it should, open that box. If you're advanced, don't let your experience trick you into overconfidence. Even seasoned providers can miss atypical wounds if we're not careful. And if you're someone like my mom watching this, just to understand, know that sometimes wounds don't heal because the body itself is misfiring. It's not anyone's fault. And the most important thing is getting the right team involved. The hardest wounds to treat are the ones that ask you to juggle competing truths. You can't push too hard in one direction without causing harm in another. And that takes patience, humility, and sometimes the courage to say, we need a team. But if you know how to clean these wounds the right way, it allows them to heal much faster. And there's actually something that I've started to do recently that's helped me speed up the time it takes for wounds to heal significantly. So watch this next video where I show you what it is, how it works, and how you can use it to treat your patients faster. Stay informed and heal well.